Funding for this program was provided in part by a grant from the Corporation for Public Broadcasting. Additional funding for COVID-related news and information provided by Arkansas Community Foundation.
Arkansans Ask is underwritten by the Arkansas State Employees Association, Incorporated, an organization of state employees working toward the betterment of state government.
Good evening, everyone. Thank you very much for joining us, and welcome to Arkansans Ask COVID-19. This is a town hall broadcast, and it belongs to you. On March 11th last year, the World Health Organization declared COVID-19 a pandemic, a global medical crisis. On that very day, Arkansas recorded its first confirmed case of COVID-19. It was in Jefferson County. Now, after many weeks of intensive treatment, that patient recovered. But now, 19 months later, 8,000 of our fellow Arkansans have died of COVID. 500,000 others have been diagnosed with the virus, and many will never completely recover. Arkansas's vaccination rate has steadily increased in the past few months. More than 3 million doses have been received by public health authorities here, public and private health providers here, but now there are boosters available, and vaccine authorizations for kids aged 5 to 11, well, that appears imminent. Still, thousands of Arkansans, tens of thousands of Arkansans, are declining immunization. Some of them fearing the vaccine itself, others denying it for reasons practical, philosophical, political, religious, and we will address those matters in the coming hour as best we are able. We are joined tonight by Dr. Robert Hopkins Jr., Director of General Internal Medicine at UAMS. He's a former chair of the National Vaccine Advisory Committee. Dr. Kellee Farris, CEO of the County Cooperative Clinic at Marianna. And Greg Reep, former state representative, former mayor of Warren. We asked for your comments and your questions prior to this broadcast, and you obliged. These are your questions. These are questions from Arkansans. They are essentially verbatim, the questions, and deliberately so. We have edited only for clarity. Whether, in your estimation, the questions are over the top or precisely on target, they are nonetheless your questions. And we will continue to take them throughout the program by email. You can send questions at paffairs@myarkansaspbs.org, by Facebook message, or on Twitter with hashtag #ARAsk. Thank you to our panel for coming in. We are in a peculiar situation, I think unprecedented in our lifetimes. We're dealing here with a situation, a story, if you will, that is medical, it's cultural, it's social, it's ideological, it's philosophical, it is political. But for one of our guests, Greg Reep, it is intensely personal. Share it with us if you would now.
Well, thank you for having me. First of all, I appreciate being here.
No, thank you for being here.
Well, thanks for saying that. I lost my wife to COVID-19, Beverly. She was a long-time school teacher in the Warren public school system and taught in some other places in Arkansas. And she had some health issues, but she was up and going. And back in early 2020, she decided in her retirement that she wanted to plan kind of our trip of a lifetime, if you will, and she planned for our entire family, myself, my son, my daughter-in-law, and we went to Europe. This was just starting to, kind of make the news that this COVID virus was out there, but we took precautions after we talked to, medical professionals in our area, and they said just keep your hands washed good and you know, just be careful. And we tried to do all that. Had a wonderful trip, had a great trip, really a trip of a lifetime. And we got back, and in about a week's time or less, she started, you know, having symptoms. And because of her other health conditions, we pretty quickly went to the doctor, and they determined that she did have it, and immediately moved her from Warren, our local hospital, to St. Vincent's.
Greg, may I interrupt?
Sure.
What did Beverly feel? What were her symptoms?
Well, she could tell she was having some trouble breathing, for one thing. She had had heart surgery, she had diabetes, and I think that was the main thing. And just feeling very poorly. And you know, we were pretty sensitive to all that because of her condition, so that's why we so quickly went to our local hospital, and they did a marvelous job of figuring things out in a hurry and got her up to St. Vincent's. She was there, I believe it was about 32 days or something like that in intensive care, most of it in a coma. Just a couple of days she was there, and it was so difficult, not only the fear of you know, not knowing what was going to happen with this disease that everybody still wasn't really sure a lot about, but we could not see her, we could not go in and see her even when she was you know, awake. But then she was, for most of that time, she was in a coma, and we could not do anything except try to talk to a doctor by telephone about once a day.
By phone?
By phone, yes, by phone.
And she was in total isolation.
Yes, total isolation. I don't know any other word to use, but just personal torture on the family, not because of the hospital or the doctors or anything like that, just the fact that we could not even be there with her and just didn't know what was going to happen. And it deteriorated. It was kind of like riding a roller coaster. They'd think she might be getting a little bit better, but then it just kept going downhill, and then finally we had to remove her from the life support.
Was there a part of you, Greg Reep, that says, no, this is not happening, this is not COVID, this is not my wife, this is bad pneumonia, this is a bad cold, it's something else?
I don't think I ever questioned the diagnosis of the doctors once they told me she definitely had it, but I just kept thinking, well, she'll get over this. You know, it can't be something that will cause her to pass away. But you know, of course, as time went on, we began to understand that the chances were not good. And if I'm not mistaken, I may be off on, I think she was the 32nd person in Arkansas to pass away from the virus, so somewhere in that range anyway. It was a bad time. It was hard on our family, hard on our community, which she knew so many people, had taught so many kids, and she had taught kids of students that she had. I think she's about in her third generation of students that she had taught, and you know, I think pretty well thought of as an educator, and it was the hardest thing I've ever been through in my life.
I don't want to cut too close to the bone, but maybe it would serve a larger public purpose if I were to ask you at what point the doctors came to you and said, Mr. Reep, we don't, well.
Sure, it was probably within about 2 weeks of when she passed away, which I believe was April the 18th. And they told me this just not going well, and we don't see, you know, and we just kept the faith, you know, that it's got to get better. My local physician was keeping up with her very carefully daily. He was getting on the phone calls with me, with the physicians at St. Vincent's, who did everything they could do. And but that last couple weeks, when I began to have to come to the realization that it was just not likely to get any better, was very difficult.
Another case. She was a beloved mother and sister and also an educator. This past August, she succumbed to COVID-19 as the town of Marianna still mourns her, as the town of Warren mourns Beverly Reep. And a son now who tried to convince his mother to get the vaccine that was not available when Beverly Reep contracted COVID. So let's go there.
My mother, Sheila Rita, she was a wonderful lady, loved by everybody, and she loved people. You know, God put people on this earth to do certain things, and hers was to inspire children to do more in life, and that's what she did.
And that, you know, I just love her life legacy. Sweet, sweet lady. Never rattled, never angry, just a sweet soul, you know, and heaven gave. I just believe that if we're too brash, we run more people away and they won't be vaccinated than those who would. So I just believe in Paul's philosophy is to persuade. Try to persuade people that they need to do it for their family, they need to do it for themselves.
I was on her about getting vaccinated, and you know, because she was a school teacher, she was one of the first ones who could have gotten it. But she told me she wanted to wait and see how it did other people.
Here we go. That's all of us. Yeah. Oh my goodness. See, 2021. Time is gone. Your rings are ready, but my heart was not.
You lost your life partner, Greg Reep, before a vaccine was available, and any number of other Arkansans have lost loved ones after a vaccine has become available, or in its earliest days anyway. Your message to them?
Get vaccinated.
And to those who are considering vaccine.
Absolutely. Of course, I had the virus myself, as did my son. And after we got home, even my brother, who was living there with us at the time, he caught it too. Now, none of us got terribly sick, but as soon as we could get vaccinated, we got vaccinated at the urging of my personal physician. I talked to him about it, but it was no question we were going to get vaccinated if at all possible.
Dr. Reeder, Dr. Farris, you knew Ms. Reeder.
Oh, absolutely. She was a wonderful woman. Like Mr. Reep said, his wife was a school teacher, and the children loved her just like they loved Miss Sheila Reeder. You know, these days, teachers, when they get home from school, they want to relax and leave the children at school, but she was one of those teachers who, after school, she still worked with the children. She had dance groups with the young ladies all year round, and so she didn't just leave the kids at school, she brought them home with her, and so she's greatly missed.
Well, there are other Ms. Reeders out there.
Absolutely.
Yeah, and you deal with them.
Yes, every day. And so, although it hurts when you have someone in a small town like Warren and like Marianna, when you lose someone who is so influential in the community, you would hope it wouldn't be in vain. You would hope that story would help others, but there are so many people who are still, like Ms. Reeder, waiting to see how other people do with the vaccine. And you know, you want to be empathetic, but we are almost a year. We are, 10 months into the vaccination, and I think we're safe to say if there were going to be some severe side effects, we would have started seeing them by now. Yeah,
in fact, and we're going to get to some questions about people who believe who assert that they have sustained or know people who have suffered some adverse side effects from the vaccine. Doctor, let's go to you right now. Does any of this has the ring of familiarity, to put it mildly?
Far too much familiarity. You know, we've seen far too many beloved members of our families, of our communities, that have been sickened, that we've lost to this virus. You know, we've seen pregnant women lose their babies, lose their lives. We've seen families destroyed. You know, you probably all heard the statistics this week that close to, you know, I don't know, 25% of families have had somebody that was caring for a child that lost one of those adult caregivers. You know, it's horrible. It's horrible.
Why doesn't this story of Ms. Reeder, why doesn't it resonate? And let's just use Marianna or Lee County. Why isn't it resonating more? Or is it beginning to, do you think?
You know, it's hard to say. You have so many, and I have workers there. I'm the CEO at the clinic there, and we have staff who still aren't vaccinated. These are healthcare professionals that understand. So it's just, I don't know. I don't think we know. I don't think there is one answer. We like to say once people are educated, or once people have someone close to them lose their lives, then that would be that trigger. But unfortunately, it's not.
You know, my experience is it's really a combination of multiple different factors. I've had, you know, lots of my own patients, in fact, most of my own patients, when we've had a conversation about the vaccine, they've gotten vaccinated. But I still have some that won't carry out the conversation.
Cut it off.
Continue to say, you know, I'm not going to talk about that. Oh. You know, we may have treated your heart disease, we may have gotten you to surgery when you had gangrene, but we're not going to talk about the vaccine.
Yeah, some questions from our viewers, but first back to Greg Reep for a second. Did this echo, did this resonate, reverberate in Warren to the extent that some of those who were reluctant are now because of Beverly Reep?
I think so, and local physicians have told me that. Of course, most of them knew her also, whether they were her doctor or not, they knew her. And they have told me that they think it had an impact. And of course, our county, I think, has ended up being one of the higher vaccinated counties on a percentage basis. I like to think it did. I hope it did. You know, I can't tell you for sure, but according to our local doctors, they feel like it did have an impact.
Question number one, and we're going to go to questions from, and again, to our television audience, we have edited these questions only for clarity. First question, we are not getting the vaccine, Ms. Jefferson tells us via Facebook. We will continue to go out in public without a mask. We have been doing that since this started. We've been just fine. If this is as bad as is being said, everyone at our church should be dead. Doctor?
Well, I'm pleased that Miss Nicole is alive. I'm pleased that members of her church are alive and healthy. But it is as bad as we've talked about. I have seen these people in the hospital. I have seen these people in the intensive care unit. You know, we can all say, I haven't seen it myself, so it must not be true. You know, that is not a safe way to approach life. You know, I haven't seen somebody get run over by a train, but I'm still not going to stand in the middle of the train track. You know, it is, you know, we don't understand the whims of why a virus is going to attack one person more than another. But we do know that this virus is affecting thousands, millions across our country, and has killed millions of people.
Well, and in fact, churches have been vectors, have they not, of significant
Absolutely. And for that very reason, a lot of pastors...
Churches, let me see, but churches among other what are termed congregate settings.
But that's one reason pastors have decided to go virtual more so now, even with the churches. And it's so unfortunate, the case, I can't remember where, but outside of Conway, maybe Greenbrier, where the people so unfortunately had the church camp, and so many people were infected. But it's nothing to play with. It is real. And I, too, am so happy that church has not had a case. But we've had several.
I think Heber Springs or Cleveland County anyway was another one. Yeah. Question or comment from a Ms. Howard via Facebook. I am 70 years old. My 71-year-old husband and I had COVID. Wasn't fun, but better it was than taking a shot that can attack your heart and brain, which I have heard, she says, of many people to which that happened. Doctor.
Well, COVID-19 attacks the heart, it attacks the lung, it attacks the brain, it attacks the kidneys. I saw a patient in the hospital not too long ago who was a very functional, active member of her community. Saw her about 2 weeks before she ended up in the hospital with COVID-19, and it destroyed her brain. She ended up essentially being unable to function without total assistance when she left the hospital. Yes, there have been a few cases of adverse events associated with the vaccine, but those few cases are far, far less common than the adverse effects that have happened with COVID-19 infection. And if we are to be honest and to think about these numbers and really talk about risk, the risk of COVID-19 is hundreds to thousands of times greater than any possible risk of even a minor side effect from the vaccines.
Greg Reep, you have shared down to the heart, soul, and the bone, and we want to thank you very much for doing that. And we're going to excuse you from the broadcast at this point and bring on someone else. You can keep your seat for just a moment anyway. Healthcare, a demanding, stressful job under normal circumstances, any kind of circumstances, but the pandemic has been a nightmare for friends and family, clinicians, anyone in the medical community. For example, a nurse in Northwest Arkansas who's been encouraging her patients or trying to get the COVID-19 vaccine.
Hey Richard, so you want to get your shot today?
Shot for what?
COVID?
Hadn't thought about it really.
Why not?
You think I really need it?
I do. You got a lot of lung problems. Is there a reason why you haven't?
There's a lot of people getting sick from it and...
Like, just feeling bad in general?
No, just...
Well, I mean, the risk of a side effect from it is a lot lower than a risk of getting COVID and ending up in the hospital with you. Because you have asthma.
Yeah, I've been there. Yeah,
You can think...
I guess I better go ahead and do it then.
You want to go ahead and do it?
Yeah.
All right.
Which arm do you want? Your left or your right?
Probably right, because I
Okay.
usually do.
All right, just relax. Might want to hold that up there.
I've had COVID twice. The last time was a couple of weeks ago. Worse than the first time I had it. I'm just here basically today. I'm a school teacher, and so I just feel like it's my civil duty to get vaccinated.
Okay, that's good.
And we're joined now by Dr. Jane Spites, who's Dean of the College of Osteopathic Medicine at ASU Jonesboro. Doctor, thank you for coming in.
Thank you.
This conversation that we've been having so far, no surprises in this into what's been related, I suspect.
No, not at all. As a matter of fact, and I want to point back to the segment you just showed. That's what's got to happen, is the conversation between the provider and the patient. I would love to think that what we're doing here tonight would all of a sudden instigate individuals to now they have clarity and the light bulb goes off and vaccines start to put me pouring out of clinics. But we've been trying this for a while. This is, these types of scenarios here, putting out that information through this type of medium, whether it be Facebook or even social media. We've been doing that for a while. The true test and the true positive outcome that I've seen personally in my own patients is the conversation like you just saw with that young lady and her patient, where you talk to them over and over again. And you say, this is important. You're important to me. You're important to me as my patient. I want you to do well. I want you to be well. And that's why I want you to take this vaccine.
I want you to have the same protection that I want for my staff.
That's exactly,
Right.
my own family, my own family that's vaccinated. That's exactly right.
Yes, but as the doctor noted, I suspect this has happened to some practitioners in Craighead or of your experience. Once a provider, a physician, an RN, whoever attempts to talk to some patients about COVID, the vaccine, or the prospect of the illness itself, the patient shuts it off in absolute denial. How do you overcome that?
Well, it just depends, and this goes back to the relationship, and some of it goes back to who did you trust before COVID? Who did you trust before the pandemic? And so for my patients, and I'm sure that's true for most physicians, you had a relationship with these patients before this pandemic ever happened. And so you leverage that relationship, you leverage that trust. I've got individuals, I promise you, I do some work for the Jonesboro Police Department, and I've got a pretty obstinate group there that I've worked with through in terms of police officers. And then, but working on them month after month after month. Just a week ago, I get a text. Sends me a screenshot of his vaccination card. And so it's that chipping away. It's that trust and that conversation that you have to have. I wish that it was as easy as putting out information and saying, look, here are the facts, go get your vaccine. I think we're past that.
Ongoing communication.
That's exactly right.
Answering questions.
Yes.
Repeating messages, coming at it from a different angle.
Dispelling myths, things that they've seen. This is what I saw on Facebook. This is what I saw on Twitter. What do you think about this? And having that conversation, not in an obtuse conversation, not that it's adversarial, it's educational. And I've found that to be successful. Now, does it take time and effort? It takes a lot of time and effort.
Entirely by coincidence, a story in one of the national media yesterday that police officers in particular are in far more danger of death from COVID than they are from an ounce of lead.
Yeah.
But there is significant resistance in police organizations across the country, not just Arkansas.
And I'll tell you, I mean, I'll be the first to tell you, they're a great group of men and women. I love them to death. I love serving with them. I love serving them. But yeah, I remember when we first started this and the vaccines came out, and I was in a meeting with a bunch of officers, and I said, okay, who hasn't gotten their vaccine yet? And they all looked at me. And the vast majority hadn't. Now, over time, we're changing that. And it may be that I go in every couple of weeks or so and I say, okay, who still hadn't got the shot yet? Right. But those are the conversations.
Yeah, and I think that's a lot of the challenge. It is. I think when people are talking in a group and they stand up and they're making a stand on something, I think that's a really difficult situation.
Yeah.
Much better to have a one-on-one or one-on-two or one-on-five conversation about what are your concerns? You know, what are you worried about? What have you heard? So we can talk through what are the facts.
Absolutely.
And what are the benefits of moving forward with the vaccination, and what are the risks of not going forward with the vaccination.
Yeah.
Right, dispelling those myths are so important because I just told a group of people a couple of weeks ago, I can leave here right now, know nothing about the weather, but I can create a website and portray myself as a weather expert, put out storm advice, and a storm is coming, or anything, you know, anything, and someone will share it as factual. You can go do that. So you have to pay attention to where are you getting your information. You trust your people in your neighborhood, and if they're sharing that information, you tend to believe it. But you just have to be careful about where you're getting it. And what we knew about COVID-19 2 years ago or 18 months ago is not what we know today. So even that has changed.
Absolutely.
And that message in itself
is
as critical as anything else we can say. It's not that our messages have changed, it's our knowledge has changed.
That's exactly right.
And as our knowledge has changed, we have to change our messaging to reflect what we know now.
A question from a Mr. King via Facebook. If the government was not exempting their, I assume government employees, some, from the shot, or if Centers for Disease Control did not exempt their employees from the shot, I may become more of a believer. But I read the ingredients on those sterilized swabs that they put up your nose. Most of those masks are made in China.
Well, CDC does have a mandate for all of their employees to get vaccinated now. All federal employees now have a mandate to get vaccinated. I work with people at the CDC. I'm on a call with people from the CDC every week, have been since December. And I cannot speak of a more dedicated group of people that are trying to help us, number one, get good messaging out about the vaccines, but number two, do everything we can to assess and prove as best we can the safety of these vaccines and investigate every signal we've seen about potential challenges. So I want to see this young man and everyone else vaccinated because it is safe and effective. You know, yes, swabs are made in China. Masks are made in China. I would be willing to bet that at least half of the clothing on every individual in this room, in this studio, and probably in the home of that individual,
I think my
came from
cell phone
Southeast
was
Asia.
made in China.
Yeah. Almost all cell phones are. You know, so
Question from a Ms. Ebron, if I'm pronouncing it correctly, via Facebook. If a person is vaccinated and can still contract, and spread COVID-19, how is that helping the next person, Doctor?
Oh, that's a great question. So first of all, one of the things that's been missed in this whole conversation is the reduction in hospitalization and death that comes along with the vaccine. And that's true with most vaccines. What you want is, there was kind of this false sense that, okay, I won't get sick at all if I get the vaccine. Well, that wasn't necessarily true. Now, we had great results initially when the data came out, but the biggest thing was we want to reduce the burden of disease. We don't want you to be in the hospital. We don't want you to be in the ICU on a ventilator. We don't want you to die. If you're at home with a little bit of a cold and a runny nose, yes, maybe you're off of work that day, but that's far different than being hospitalized. The vaccines are doing that, and they're doing that very well. All of them, all the ones across the board that are approved here in the U.S., whether it be Moderna, Pfizer, or Johnson & Johnson, are successful in reducing hospitalizations and deaths, which is what we want them to do. In terms of the spread of the virus, if I've been vaccinated, brand new data has just come out within the last 2 weeks, and I know that I'm not the only one aware of this through the Lancet, that says even if you're vaccinated, the likelihood that you will spread the virus to someone else and actually infect them, there's now question if that even happens. And if it does, it's extremely low. Because I'm fully vaccinated, if I were to catch COVID, my antibodies will surround that virus. And so any of the virus that I shed actually may be surrounded by those antibodies, therefore reducing the chance of me actually successfully spreading and infecting someone else. And that's just recent data that came out. So, I mean, just more and more data continues to come out about the positive aspects of these vaccines and how they truly are life-saving.
And even if you have the possibility of spreading that virus to someone else, the amount that I can spread is far less than somebody that's unvaccinated. So far greater risk reduction, far greater likelihood of healthy life with the vaccine than taking a chance on the virus itself.
Even in the amount of time, too, in terms of the amount of time that's spread. It's a much shorter amount of time that I would spread it versus someone who's unvaccinated that can spread it up to 15 or 20 days.
Follow-up question from another Arkansan. Many people are following, quote, real science, from the viewer. Many people are following real science, which says the vaccine is dangerous, but that science is being suppressed. Many people's doctors have told them not to get the shot or to wait.
Well, in every group there are going to be differences of opinion. And that applies to healthcare professionals, to physicians, to nurses, to scientists. And I have looked at a tremendous amount of data on this vaccine, some of it fully published, some of it in what we call preprint versions, some of it in the not standard and approved literature. I can tell you that I have not seen anything that looks like a true study of this vaccine that has shown harms that's been suppressed. We have seen studies that have shown a low risk of mild heart inflammation in young men with certain vaccines. That has openly been published. We've seen studies that have shown a very low risk of some blood clotting with one of the vaccines in some women. We've seen some studies that have shown a risk in older men with one of the vaccines for a syndrome called Guillain-Barré syndrome. None of those things have been suppressed, but they are, again, far less likely to happen than any of those complications from COVID, and that's on terms of thousands times higher risk with COVID infection.
Perhaps from suspicious websites, Doctor, that you mentioned,
you know,
Dr.
that
Farris?
saying, bad news travels fast. So in this sense, you get so much information on social media that those accurate studies aren't being shared. But one thing that is very important, when you're vaccinated, you get this information to sign up for V-Safe. It is very important that once you're vaccinated that you follow through with that and send in that information on what your symptoms are, so when studies are conducted, they have accurate information.
And so that we can measure your symptoms.
Yeah, Dr. Sputz, there are, and we have all seen them on cable news programs, on internet sites. There are individuals with MD after their name or DO after their name. Or Ph.D. after their name, and they seem credible.
Right.
Take it from there.
Here's the problem. This is an extremely complicated subject. When we talk about the coronavirus or COVID-19, or really even the human body and the physiology of the human body and how it works and how it doesn't work, and then we throw in pharmacology in terms of the vaccines, new medications, it's very complicated. It's overwhelming. I'd be lying to you if I told you that I knew everything about COVID-19. I have no idea. I lean on research deans and PhDs and infectious disease specialists, and we share information back and forth because we don't know everything. And we're still learning a lot about this. Even with the amount of knowledge that we had going into this pandemic, we are still learning. We're still learning a lot. I can't imagine someone in the general public without having this background being able to really digest this information. So where do you go? Generally speaking, I get asked that question a lot. I go to major groups, the Infectious Disease Society of America. I go to the CDC. I go to well-respected clinicians and physicians in the field. Are you going to always have an outlier? Yes. And generally speaking, on the outlier side, it's going to be what do you have to gain? Are you trying to get? Are you trying to sell some vitamin concoction? Are you trying to gain something out of it? Do you need more followers on Twitter? Are you trying to get votes? What is the angle? There's usually an angle.
And that spot is probably more important than anything else. If you see somebody asserting something, that there's a link to something being sold, you know, whether it's a certificate or a product or a medication, buyer beware.
Yeah.
Yes.
Yeah.
Right.
Question from a viewer. Why, a statement and a question. We don't get the shot because we don't want to expose family, others, to the germs from the vaccine. The vaccine has fetal cells in it. This won't be the last time this comes up tonight. The vaccine, she says, has fetal cells in it from aborted babies and cells from monkeys. It also has germs.
So
Doctor?
Yeah. Okay.
Go ahead.
One of my favorite topics. There are no fetal cells in any of our COVID-19 vaccines.
Were they developed with fetal cells?
The Johnson & Johnson vaccine, which is a viral vector vaccine, that virus was grown in a tissue culture that 20, 30 years ago may have come from a fetal cell line.
May.
Can
we say definitively one way or the other?
The answer
it's a big question for a lot of you.
And it probably was. It may, but I can't say it for certain, but it probably was. The messenger RNA vaccines have nothing that's ever had any contact with fetal cell lines. There are no germs in any of these vaccines. In fact, they have to be sterile and not have germs in them for you to be able to use any product that you're going to inject into a human body. And there are no toxins or preservatives in any of these vaccines either. That's because they're in single dose usage.
Computer chips, maybe?
No computer chips.
And fetal cell lines have been used for decades in the development of vaccines and other medications. So it's nothing.
Acetaminophen, ibuprofen, Prilosec, all were developed using fetal cell lines.
Absolutely.
But it is, Dr. Farris, this is a profound religious, spiritual, philosophical, ethical question for hundreds of thousands of Arkansans. How do you address that? What would you say to them?
I let them know. I give them that information. Did you realize that ibuprofen, do you happen to have diabetes? Do you have GERD? You know, any of these things, the medications were developed using fetal cells. So once they know that, and that no children were aborted for this reason, that the fetal cells were from decades ago, that it tends to ease that a little bit in people that believe that.
Certainly when you talk about the Moderna and the Pfizer vaccines, it's really not even a conversation. The fetal cells were not used. They're not in those vaccines. It's just not even part of the conversation. There is a misconception. People think that if you get the vaccine, you're getting the virus, and that's not true either. We don't inject the virus. Are there such things as live virus or attenuated virus vaccines? They are. That is not with the COVID vaccine, though. It's a whole different scenario. So you don't get COVID by getting the vaccine. That means you can't spread COVID from getting the vaccine. So I hope that clears. But that's a common question. I've gotten that a lot as well.
Via Facebook, Mr. Steve Taylor comments. I do not wear a mask. I will not take a shot, and I do love my family. People who take the shot have a higher viral load than those who do not and are therefore super spreaders. Take 2 doses of ivermectin a week and you won't get COVID. Quote, that's a fact.
Let me be clear, first of all, and I think this is important. I have no doubt in my mind that he loves his family, regardless of whether he wears a mask or takes the vaccine. And I hate that these topics have gotten so politicized to the point where we're questioning whether we even love our own family members, whether you're taking the vaccine or not, because we've gone too far, I think. And I think we've gotten so divisive that we've gotten to that point. And I saw some of that early last year. That's another conversation. But at any rate, and I'll pass this off to Bob in a second in terms of the ivermectin conversation, because he's far more versed in that than I am. But we know that the vaccines work. We know they're safe and they're effective. There have been 3.2 billion doses given across the globe. We know they're safe and effective. We know that they reduce the incidence of hospitalization and death amongst those that have it. We're going to see one hopefully here in November, approved for ages 5 to 11. I'll do the same thing that I'm sure everybody else does. I'll look at the data and then I'll decide if my 10-year-old gets it. I suspect my 10-year-old, just like everyone else in my family that's gotten it, will get that dose as well.
There is no truth to the statement that you get a higher viral load if you've been vaccinated than if you haven't been vaccinated. And ivermectin is a very interesting product. It's a chemical that was isolated 20 years ago. It was shown in a test tube experiment to potentially reduce the amount that COVID virus can replicate in a test tube in a tissue culture. Now, I don't know whether there are fetal cell lines in that tissue culture. But in that setting, it showed some inhibition. But the levels in that tissue were much higher than the levels of ivermectin that you should get into a human body without causing toxicity. And to date, the few small studies, there have been conflicting data in a number of small studies on ivermectin. There is currently a study that's being supported by our National Institutes of Health to evaluate ivermectin for COVID-19. But the current evidence is that it does not help in prevention or treatment of COVID, and it should not be used outside the setting of a controlled clinical trial where we can make sure you don't get toxicity from the drug in trying to do something with COVID.
Time permitting, we'll come back to that. A Mr. Branch via Facebook says, I, for one, am questioning why the experts and politicians in America completely ignore natural immunity.
Let's talk about natural
immunity. Yeah, I think that's a great topic.
Let's talk about natural immunity, okay? What does it take to get natural immunity? It takes you getting a COVID-19 infection. Getting a COVID-19 infection is like taking a set of dice and rolling it on the floor. You're rolling those dice for the chance that you will have a asymptomatic or a mild case, as opposed to having severe COVID-19, needing to have a breathing tube put down, needing to be put on a heart-lung machine, or dying. Okay? If you survive COVID-19, about 40 to 60% of people that survive COVID-19 will develop some level of antibodies. Antibodies alone do not predict whether you have protection against COVID infection. Antibodies that are what we call neutralizing antibodies, a specific subgroup of those antibodies, do tell us that you have protection from infection. That occurs in a small proportion of people who get COVID-19 infection. The problem is we can't tell who they are. Right. There's no way to predict that.
Yeah.
So you're rolling your dice on your life for uncertain benefit, far less secure than using a vaccine that we know is safe and effective.
The other piece is those antibodies, just like antibodies from a vaccine, they wane. They go down over time. So those individuals that got COVID this time last year, the antibodies are dropping. And we're seeing that in other countries as well. We're looking at those studies over there and seeing those antibody drops as well. So in terms of their protection, it continues to go down. So that's not something you can depend upon if you even have it, which we can't prove that you do or not, because right now we're not to the level of testing for that.
Right. So it's not being ignored. To his question, it's not being ignored.
That's
We just
exactly
don't
right.
know yet.
That's exactly right.
We unfortunately do not know for certain how long you will have natural immunity after having COVID-19. We just cannot say for certain. So it's not being ignored.
And that's a point that I think we probably ought to emphasize is that I think it's important for those of us that are talking about this topic to recognize and to state very openly where we don't know. Because not knowing doesn't mean we're hiding, doesn't mean we're trying to cover something up. We have to acknowledge where there are gaps in our knowledge. We've learned a tremendous amount in this last 2 years about coronaviruses and about COVID-19, but there are still gaps.
From Mr. Robert Dix, a question and a rather pointed comment. What are the chunks in the vaccine? You cannot put chunks in your veins and expect to live very long. Some chunks you can see with a microscope. All of you that are pushing it will pay.
So I think what he's referring to by chunks are the tiny, tiny pieces of RNA, RNA being a genetic material that is in the outside part of your cell, in the cytoplasm of your cell, that tells our immune cells to make a protein that looks like the spikes on the surface of the coronavirus, so that our immune system can then develop antibodies and protect us from future infection. There are no chunks or pieces in that vaccine that are big enough that you can see with a microscope. Even you might be able to see them with an electron microscope, but I don't think you can even see them then.
From Ms. Beck via Facebook, I have a friend, quote, I have a friend who was fully vaxxed and has had 2 strokes. Another friend has inflammation of the heart, another permanent disability from ringing in the ears, all because of the vax. Dr. Spikes?
We know there are side effects to the vaccine, but in terms of the risk of those side effects versus the benefit, it's extremely low. Now, in terms of the vaccine actually causing strokes, causing heart attacks, I'm not familiar with any data that is specific to that in terms of a significant risk of stroke or heart attack from that. Have I heard about the ringing of the ears? I have. It's a very small percentage of individuals that have had that. It's about a 0.004% chance, is my understanding, just based on some data that I've looked at recently on that. But it does go away within about 4 to 6 weeks, is my understanding as well. Are there side effects to the vaccine? There absolutely are. And I don't want people to think that there aren't. They're like, these things are just, you get an injection and you're good to go. The most common side effects are pain at the injection site, some fatigue, maybe a little bit of muscle aches, low-grade fever, upset stomach, typically within 12, 24, 36 hours afterwards. Those are very common. Are there rare side effects? Absolutely there are, and we track those, and we post those, and that's not anything that's being hidden. It's freely available if you're going to the right sources for your information.
And, to this person who knows people that have had these alleged side effects, I hope that person or their healthcare provider reported those to the CDC so that they can be thoroughly investigated and evaluated for whether there truly is a linkage to the vaccine.
I want to go to Dr. Farris here just for a second, because I know communities of color in Arkansas, as elsewhere across the country, have been absolutely ravaged by COVID-19. Of late, we have seen an uptick in the vaccination rate, particularly in African American, Latino communities, a long-standing suspicion of, quote, white medicine in communities of color. Are we getting beyond that now?
I think we are, with that education, that people sympathizing, empathizing with them as our family members are vaccinated and you are able to see someone who has been vaccinated and what it has not done to them. People are tired. People are just literally tired of this pandemic. And so that is forcing them to say, I'm going to do whatever I have to do to not only protect myself and my children, but to help get us out of this mess that we are in. 20 years from now, we'll look back on this, and our children, our grandchildren, we'll be looking at it like we look at smallpox now. You know, no one will have, hopefully, no. You know.
You are, I believe, an African-American woman. Is there any reluctance on your part to take the vaccine yourself, your children, your family, or others?
As soon as I heard that the vaccine would be available, I said I will be the first. And not only was I the first one in my health center to take it, I videoed myself taking it. I videoed my reaction every several hours afterwards. I very open about being in the bed for 2 days. I will not tell anyone that there is no side effects. I personally stayed in the bed and was in tears for 2 days. But I kept saying I would much rather be in the bed for 2 days than in the hospital bed for 2 months, or die, God forbid. But I have a 10-year-old son who does not want to leave the house, not because he's afraid of of COVID necessarily, but he's smart enough to know that I am not protected the way I could be, and he wants to be vaccinated, and I will allow him to be vaccinated.
Question via email, is there any end in sight to the push for continued vaccine? Are we turning the corner on this? I think this is what the viewer is asking. Are we turning our infection rates seem to be diminishing?
So our infection rates are coming down now, but remember we saw this same pattern in the spring, infection rates coming down. And so we started backing off on some of our public health measures. People were doing more gatherings. You know, people started to do more sporting events. And that led to the beginning of the upsurge in the Delta virus. And so I'm concerned that if we get back to business as usual, that we put ourselves at risk for two things. Either influenza going wild in our communities, or the next variant coming out and causing another surge of COVID-19, or even worse, both.
Question from Ms. Price via Facebook. How hard is it to understand that getting the vaccine is helping everyone around them, that it is the right thing to do? As long as people continue to not get vaccinated, the virus will keep mutating, and it may mutate to something far worse. Doctor, correct?
Yeah, as a matter of fact, if you want her to take my spot, she could come take my spot now, and I'll just let her take it. But that's exactly, that's spot on. And what she said was exactly right. Where does the Delta variant come from? If you scale back and look where the Delta variant came from, it came during a period where we had globally a high infection rate. Across the globe, when you go back, okay, well, it was first discovered in December of 2020. What did it look like in December of 2020 across the globe and across our country? Some of our highest infection rates we had. That's where variants come from. They come from spread, where they can jump from person to person and they can change their genetic material a little bit. And that's where the variants come from. And so he's exactly right. So as long as you have basically unfettered spread throughout, that's where your variants can happen. Are we watching other variants? Absolutely. We're watching variants all over the world right now. None of them right now seem to be taking off, but you don't know. We don't know what the fall and winter are going to look like, because we know people are traveling more. We can expect the holiday travel will pick up more than it did last year. What is that going to do in terms of viral spread? It's kind of a wait and see.
All right, from a Ms. Ramirez, and Dr. Farris, we'll begin with you. I hope that all three of you, Ms. Ramirez says, I hope you're taking note of these comments, these questions that have been phoned in, and that you are not offering us just more propaganda.
Absolutely not. And I'm so glad we're doing this. And we continue to have town halls and events where people can come in live, ask questions. At the beginning of this segment, we were told that the grammar, nothing was changed. Spelling may have been changed, but your questions were not changed. So we're answering the questions the way you wanted them to be asked. And that's what is so important about people tuning in to shows like this and us going out into our communities, is giving people the chance to ask those questions, you not have to wait on an answer.
Ms. Ramirez, thank you for asking that. You know, I mean, again, I think all of us have spoken to many, many people over the course of this last 20 months. And, you know, Dr. Spates and I, you know, are healthcare providers. We're seeing patients in our offices. We're teaching the next generation of healthcare professionals. We try to help communicate this information to them so that we can continue to spread what is reliable scientific information to help protect the lives and health of Arkansans.
Just a few seconds later, how did we get here? How did we get, Doctor?
How did we? Well, I got in my vehicle in Jonesboro and I drove. But you mean in terms of how did we get here as a population? So, and this is just my personal opinion. What first caught my attention was when we first identified the virus. We first identified it, and I have colleagues, obviously, I work for NYT, it's a New York-based institution, so they were just ravaged by the initial wave that came through New York. And I mean, they were living with it every day, and it was just horrific. And I was hearing all the stories, and I was just thinking to myself, it's gonna come this way. It's gonna make its way here. And then we started getting information out, and then there was discussion about masks. And then there was an immediate discussion, and it almost looked like that you started separating people who were and weren't wearing masks, and it started to divide our country. And that's what I saw. And I'll be honest, it went downhill from there, in my opinion. This is my personal opinion, is then you had to pick. And all of a sudden, now things became very personal, almost like to the level that I hold my religious beliefs. That if I go too far in one direction, now all of a sudden I'm not in my core group, the people that I normally am with and hang out with. And so I need to stay in my core group. And so if I take this vaccine, if I believe this, or if I follow that, then I'm not there.
I have to end it there because, lady, gentlemen, we are doctors. We are simply out of time. We thank you for yours. Sure. We thank you for watching. Take the jab. Good night.
Funding for this program was provided in part by a grant from the Corporation for Public Broadcasting. Additional funding for COVID-related news and information provided by Arkansas Community Foundation.
Arkansans Ask is underwritten by the Arkansas State Employees Association, Incorporated, an organization of state employees working toward the betterment of state government.